Cruella Deville is a 65-year-old woman who lives independently. Cruella's interests include reading fashion magazines and maintaining her fur business. Cruella was in a car accident on November 12th and spent 3 days in inpatient acute rehab. Upon discharge, she was referred to OT due to difficulty completing ADLs and IADLs secondary to depression. Past medical history includes smoking, hypertension, previous drug addiction, and histrionic personality disorder. Cruella works long days creating fancy furs for high fashion companies and personal use. Prior to car accident, Cruella did not require any external supports with ADLs and IADLs. OT will evaluate current levels of functioning and determine the need for skilled therapy services. Cruella demonstrates initiative and work ethic through her successful fur business. Cruella tends to be enthusiastic and passionate. She is persistent in meeting her needs and wants and thrives off of social engagement. You can often find Cruella being the center of attention at social gatherings. Cruella is known in fashion circles for being daring and edgy and often trying new concepts. We selected the cognitive behavior model to address Cruella's decreased independence in ADLs and IADLs, as she's been experiencing depression secondary to her recent automobile accident. This model is appropriate as it is commonly used for clients who have a higher level of cognition and a capacity for metacognition. The development of CBT was shaped by the theories of Freud, Adler, Ellis, Glaser, and Beck. CBT was developed to demonstrate how thinking shapes emotion and behavior. CBT's foundations are in social learning, cognitive, and behavioral principles. To expand upon principles, CBT includes the belief that changing thoughts influences behavior. Therapy can address negative or irrational beliefs that may be harmful to everyday living. CBT believes that people participate in activities that they believe they can master. This is important for therapists to consider when creating the Just Right challenge. Additional core beliefs of CBT include the belief that people benefit from repeated opportunities for skill development. One's environment can facilitate or hinder problem solving. CBT theorizes that learning is a lifelong process and that therapy should take place in a client's authentic context.
Cognitive behavioral therapy is the practice model used to guide our thinking with Cruella. With CBT, the therapist attempts to use activities to demonstrate to the client the link between thoughts and behavior and to develop cognitive abilities that lead to successful outcomes and enhanced performance. With increased self-knowledge and self-efficacy, clients change the way they view themselves, and this new view will hopefully translate into novel situations across a variety of contexts. The CBT approach will help Cruella see that her way of thinking influences her behavior and help to increase her cognitive awareness. Based on our selection of CBT, we chose the Canadian Occupational Performance Measure for assessing Cruella's daily living. We found the COPM to be a good fit with both the CBT approach and Cruella. The COPM opens communication between client and therapist, which helps build a good therapeutic relationship. The role of a therapist during the CBT process is not one of expert, but may include that of a teacher or coach. Based on the principles of CBT, we want to empower Cruella to take control of her thoughts and behaviors in a positive way. With the COPM's ability to recognize progress and track self-mastery, Cruella will feel motivated and more self-sufficient. There are a variety of factors that appear to be interfering with Cruella's ability to complete her morning routine and continue with her fur business. After her car accident, Cruella reports feeling distraught about her business and that her whole life is ruined. She no longer feels confident in her ability to perform necessary job duties and everyday life tasks. Cognitive behavioral therapy theorizes thoughts influence behavior and assumes that people participate in activities they are confident they can master. Cruella no longer feels capable in her performance, which is evident in her ADL and IADL participation. She prefers not to try these tasks for fear of failure. The following are Cruella's goals. She will complete morning routine independently in 10 out of 14 tries within 2 weeks. She will return to work on 4 out of 5 days within 3 weeks. The COPM allows us to better understand Cruella's current view of her occupational performance as well as her progress over time.
For the first goal of completing her morning routine, one intervention approach is to teach Cruella how to use positive self-talk in order to increase her motivation and overall confidence to complete her daily tasks. Each day, Cruella can remind herself of her past life accomplishments and that she is capable of achieving success. In addition to positive self-talk, the occupational therapist can work with Cruella at identifying her top accomplishments, such as winning her court case against PETA and starring in the latest edition of Celebrity Rehab. Cruella can create visual reminders of her proudest moments that can be displayed throughout her home. For the second goal of returning to work, Cruella will attend CBT group therapy. Group therapy sessions will focus on stress management, coping skills, and developing strategies for successful return to work. Since Cruella enjoys taking part in social events, this setting would be motivating and conducive to active participation and engagement. Throughout the therapy process, the occupational therapist can use the Socratic method to question absolutes and challenge Cruella's irrational way of thinking. Through decatastrophizing Cruella's thoughts regarding her fear of failure, Cruella can take small steps to changing her thoughts and consequent action.
There is an abundance of evidence supporting cognitive behavioral therapy. Researchers found group CBT to have a positive effect on depressive symptoms for patients with treatment-resistant depression. The client's improvement in psychosocial functioning and depressive symptoms were sustained at 12 months following the completion of group CBT. This evidence helped us with our selection of CBT as a practice model to guide the intervention process. The evidence also justifies the use of group therapy with clients experiencing depression, which is applicable to Cruella. Evidence is essential to providing rationale for best practice and client-centered care.